Although maternal and neonatal mortality has decreased globally, in sub-Saharan Africa it remains high. In 2015, this region accounted for over half of the global maternal mortality. In Nigeria, the 2018 Demographic and Health Survey showed that maternal mortality was 512 deaths per 100,000 live births. Available evidence has shown that having birth companion, BC, is a low-cost beneficial intervention that is vital in improving quality of care during labor and delivery. Despite women historically being supported by other women during labor and delivery, this is not common practice in Nigeria. A birth companion, BC, takes part in one of the most intimate, special moments of a mother's life. This role is undertaken by someone who is trusted, kind, and supportive and can be there for a pregnant woman through labor and childbirth. These kinds of supports required are physical, emotional, spiritual, and security.
The presence of a bed companion during labor and delivery shortens the labor process. It helps reduce pain, and it also helps decrease the incidences of cesarean section. But with all these benefits, we found out that implementation of having a bed companion in our labor rooms in Nigeria have been very, very, very suboptimal.
The Jhpiego clustered randomized controlled trial, which took place in Nasarawa and Kano states, was to determine the feasibility and acceptability of the birth companion intervention and evaluate the impact of BC intervention on coverage of BCs during labor, birth, and postnatal up to 24 hours period. In each of the states, 12 facilities were selected, 9 intervention and 3 control. Healthcare providers in both antenatal clinics and labor wards were adequately trained and oriented on the 8 intervention package, ensuring its seamless integration into the services they render. Facilities were supported with light curtains and chairs in the labor ward for privacy and to make the BCs comfortable. Communication materials, video animation, posters, and brochures were supplied to make orientation of pregnant women and their BCs easy.
The birth companionship is a model that tells that women can be with their own loved ones when they are in labor, during labor, during delivery, and even postnatal. For us to have chosen Nasarawa State and Kano for the birth companion implementation or intervention, we were also looking at the states in the north, because the study actually, we want to try to see what level of birth companionship are there in the north. And because of the presence of Jhpiego already in Nasarawa State and Kano, that was chosen. On the other hand, the indices of maternal and neonatal mortality, is relatively high in these 2 states. We are looking at the feasibility, acceptability of birth companion.
A woman is encouraged to bring a companion to support her during labor and delivery. The BC can be the woman's husband, family member, or her friend. Having the opportunity to be with a birth companion during labor, delivery, and postnatal periods offers tremendous benefits to both mother and the newborn.
Yes, my husband was with me when I want to give birth. He was helping me out, rubbing my bags, giving me water. And anytime I want to go and ease myself, he's helping me.
An bar mama na ta shiga, na ce wannan da ta mun, na ce wannan da ta mun. So na ji dadin tsarin na an kawo wannan. Gaskiya Allah ya kara muku albarka.
Shigowar da muka yaka da 'yar uwata, ina ganin ta, ina jin daɗi haka. Idan na buƙaci abu haka tana bani, idan wani abun nema haka tana mini shi akan kari. Haka likitocin su ma haka suna wannan ina.
A birth companion, BC, on arrival to the labor ward with parturient woman is given an apron or jacket as an identifier and is oriented to his or her roles through a video animation or a poster showing the roles and responsibilities of a BC to the parturient woman in pictures.
Yes, well, as a man, I should understand that I need to support her. So it's very, very important. Price. Because I always feel coming inside there is meant for women.
Bayan muka zo kuma aka karbe mu da hannu biyu. An karbe mu hannu biyu aka ba mu waya babban waya. Ni kallon dai duk abin da yake tafiya. In sake kuma na yi kalla poster. To, abin da na gani dai iyare don gwargwado wanda na iya yi da na gani.
To da ba ya haka ba ko mun je da mai naguda ma na ce mu je waje. Ko meye mai naguda na yi ko tana yi ba mai shiga ba. Sai na ga yanzu kuma an ce muna ni zan zauna a cikin ɗaki da ta. Duk abin da tana son fita ina tare da ta.
Pregnant women are counseled at third trimester in ANC clinics to select the BC of their choice, and this happens during the ANC. During labor and delivery, the BCs are prohibited from interfering with medical procedures. However, the providers have always proclaimed that the presence of BCs in the labor and delivery ward is so beneficial.
So the birth companion will help the woman, probably if the woman wants to go to the toilet, she helps her go to the toilet. If she needs things, she can help her with the things, and she's always together with the woman in case the woman needs something, and she calls the attentions of the health workers in case if she suspects there's any danger or there is any abnormality coming up.
We use our brochure when we explain to them the benefit of their birth companionship. Then we also use our poster we use our posters to tell them what is birth companionship. Then we explain it to them. Then when they are going home, those that are in third trimester, we give them the brochure to take it home so that they should coach their birth companion.
With the presence of birth companion, it helps a lot, with allaying anxiety in the patient and also giving the patient the reassurance, to move on smoothly through pregnancy and delivery, and also help to bridge the gap, especially communication gap and care gap between the healthcare providers and also the patients.
One good thing about the birth companion is in Kano is very sensitive in areas of men going into the labor room. But wallahi, I will tell you that men are embracing it. If there are no other patient, the husband will come into the labor room and see what is going on. In one of the facilities I was supervising, that is Imam Wali, a birth companion, a man, a husband, said he never knows that this was what his wife was going through. He was shedding tears that when the head was coming out, he felt as if he doesn't even know. From that day, he valued his wife, he respected his wife, he loved her more.
Shi birth companion yakan zama miji ko uwa ko ‘yar uwa wanda za ta zo da shi zai zauna da ita a lokacin take naƙuda har lokacin da ta haihu har bayan mata haihu.
Major barriers cited to implementing routine use of the birth companion intervention package in health facilities include lack of privacy, especially for male BCs, and cultural barriers. Initially, some concerns like influx of relatives leading to overcrowding and interference with procedures in the labor room were identified, but these were overcome in no time with continuous orientation.
The good thing that happened during the project was the fact that with support from Jhpiego, some of our facilities, got to have demarcation, in the spaces where our women come to deliver, so that room can be created for the birth companion. Without the demarcation, you will not be able to have, let's say, for instance, 2 people in labor and 2 birth companions in the same space, because that will not work out. So that's a support that we got, which we feel is useful.
There's benefits in the system, the whole health system, whereby now our healthcare workers are more informed, and also their relationship with their clients has been improved. We also have seen turnout, that is from the side of the patient or the beneficiaries. We have seen turnout. People are now coming in numbers to actually access services, particularly antenatal services.
The impacts of the Birth Companion Intervention Package are significant and will go a long way to improve quality of care and improve maternal and neonatal health outcomes if sustained. Based on the WHO recommendation of BC for every woman during labor and delivery, the new Labor Care Guide, which is used for monitoring labor, has a column for documenting if a woman in labor has a companion or not.
The study is kind of a very good one because we have the chance to iterate, we have the chance to correct mistakes.
With this intervention, I think it will encourage hospital birth, thereby reducing a lot of morbidities and complications that happen with home deliveries.
How can they have more than one labor? Some will have 2, 3, and we can now dedicate a particular one for males. I think that's the challenge we had in Kano.
And Nasarawa State is fast becoming a favorite of Jhpiego. The reason is simple. They know that they will achieve project objectives.